Hi, good morning. My name is Chris. I'm going to be your instructor this morning. We're going to do a brief review. We're going to watch one of the videos, and then you have a chance to demonstrate what we're going to do. We will actually be doing team CPR today. It's going to be a little different because of COVID. You notice you're in lines of 3. So when you go to do the practical part, team 1, team 2, team 3. You will work on one individual mannequin. That way you're still socially distanced. So that way the closed loop communication is going to be that much more important because you're not actually physically working on the same patient, but you theoretically are, just on different mannequins. That makes sense? Okay. Little brief history on me. I'm a former member of the State Search and Rescue Team for the state of New Hampshire. I am currently a registered national EMT, wilderness EMT, as well as being licensed in Virginia and New Hampshire. Okay. Most importantly for you, I'm a certified American Red Cross instructor, certified to teach this class, as well as advanced life support and pediatric advanced life support. Okay, go around the room, say your name and why you're getting certified or recertified. If you say for work, tell me what you do. So when I give you your scenarios later today, I'm going to try to make them a little bit more realistic of what you would actually encounter. Okay? Start with you, please.
My name is Erica, and I'm getting this certificate because I'm going to be a RBT, registered behavioral technician.
Okay.
I'm Carla. I'm going to mix my word. I'm a medical assistant out of Unresponsive.
Okay.
Hi, I'm Christine. I'm a registered nurse, but I haven't practiced in a few years because I've been living overseas, just moved back.
Okay. Sir, come on. You have your online completion?
I have it on my phone. Is that okay?
I just need to see it. I bet you're out.
Yes.
Going for Gabriel or Liliana. Go ahead and drop gloves and have a seat in the front row there. When you're on a team. Name and why you're getting certified or recertified.
Name's Adam Clements, and I work in endoscopy in the hospital.
Okay, you don't even put them on yet, unless you really want sweaty hands.
My name's Jackie, and I'm an athletic trainer, so I'm getting recertified.
Okay?
Hi, my name is Trifina. I'm a pharmacy intern.
Gotta have it.
My name is Jason, EMT.
Okay?
My name is Mia, and I'm also going to be an RBT.
Okay?
My name is Kayla. I'm an LPN.
Okay. Cool. All right, so what's the very first thing we do when we come upon a scene or situation? Check to make sure it's safe, right? What are we going to do after we make sure it's safe? If they're responsive, we'll go ahead and get consent and treat as appropriate, right? If they're unresponsive, what are we going to do? Before we check for pulse and breathing, what are we going to do? Yeah, we're going to check for responsiveness, right? And how do we check for responsiveness?
Shout.
Yeah, shout, shout, shout. Hey, are you okay? Right? If they don't respond, then what are we going to do?
Hold on a second. Yeah, hold on.
Yeah, rapid says we're going to check for breathing and a pulse. How long are we going to do that for? At least how many seconds? 5, no more than 10, right. We're going to check for the pulse. Make sure you check on the same side you're on, okay? And this is probably dating myself. The first time I got certified, they said don't reach across the throat to check. It looked bad. Someone might have a camera, and that'll take 2 weeks for the film to get developed, then they'll make you look bad, okay? Guess what? Everyone has a camera nowadays, right? They don't have to wait for the film to be developed. Then you check for the pulse. Check for the pulse same side you are, not across. Also, reaching across the throat to check the pulse, you can impede the airway as well, okay? You're gonna check the pulse. You're gonna lean down, look, listen, and feel. You're looking at the chest to see if you can see it rising, and you're also listening and feeling to see if you can hear them breathing, okay? Let's say that the adult has a pulse, but they're not breathing. What are we going to do?
Ventilation.
Ventilations. How many and how often? For adults. Ventilations. How many and how often?
Once every 5 minutes.
one every 5 to 6 seconds, right? So if you're using the BVM, make sure where it connects, the mask connects to the bag, goes between your thumb and forefinger. Put it over, raise the chin up, and use the EC hand motion to get, and then I'm going to squeeze the bag. How much am I squeezing the bag? Half the bag, right? Approximately 400 to 650 milliliters there, half the bag, okay? So it's been 2 minutes. We've been giving breaths one every 5 seconds, and we go to reassess because it's been 2 minutes. Now they're not breathing and they don't have a pulse. What are we doing? We begin chest compression, right? When we realize they weren't breathing, we call for help for additional assistance, right? Either activating a 911 system or calling the code if you're in a building that has it, right? So now, over the years, there's been a number of ways to figure out where to put your hands to do chest compression. Okay? Really, the base of your hand goes on the sternum, the hard center bone in the middle of the chest. Your middle finger is in the middle of your hand. Amazing how that worked out, right? Your middle finger goes directly across the nipple lines, lock your elbows, get your shoulders directly over, and then compress. How deep am I going to compress the chest for an adult? At least 2 inches, no more than 2.4 if you have a feedback device, right? How many compressions am I going to do with a single provider? 30, then what am I going to do? You're going to give 2 rescue breaths, right? Use the head tilt chin or the more modified jaw thrust if you've been trained to do it if you suspect a head injury. Okay. How many compressions do I have to give in a minute? 100 to 120. Now that I've started CPR, when can I stop? Return of spontaneous circulation, return of Ross, signs of life. Yep. When else can I stop giving CPR once I have started? What?
If you're too exhausted to finish.
Yep. CM becomes unsafe. When else can I stop?
When additional help has arrived.
Additional help arrives, but you have to be careful. You are BLS certified. When additional help arrives, they have to be BLS or higher to relieve you. Okay, in a controlled environment, that's not a big deal. Because most people will be BLS or higher. They can relieve you. But if you're out shopping somewhere or out doing something, and you decide to help someone comes around and goes, I'm training first aid CPR. Can I help you? They can help you, they cannot relieve you. If they relieve you, it's called abandonment. You don't want that. Okay? When else can you stop giving CPR? So, Chief Ross, someone relieves you that's BLS or higher, the scene becomes unsafe. There's one more that's kind of important. You are presented with a valid DNR order. Okay? You are presented with a valid DNR order. Someone hands you a DNR. It's valid, stop CPR. Okay? Them having DNR tattooed across their chest does not count. That is not valid. Alright? How do we check for responsiveness for an infant? Yeah, tap their foot, right? Baby or Joey or whatever their name is, or baby, tap their foot. Where do we check for a pulse on an infant? Brachial, yeah. How do we give compressions as a single provider for an infant? Yeah, 2 fingers straight up and down the chest, right? Unless you have long, sharp fingernails. If you have long, sharp fingernails, do not go straight up and down. Won't be a good day for you or the infant. You'll create a puncture wound, possibly into the chest, and more paperwork, and it's just messy. Don't do it. Use the pads of your fingers, okay? For youth, what classifies as a youth for BLS? What age to what age? 12 months onset of puberty, exactly. So with a youth, how far do we compress the chest? 1.5 to 2, it's almost 2, so 1.5 to 2 inches, okay? If you have a smaller youth, And you can do one-handed compressions and compress the chest 1.5 to 2 inches. You can do so, and it would look like this. Okay. When you go to give rescue breaths to a youth, it can be a little complicated if you're actually giving mouth to mouth. Okay. There to pinch the nose. You can use your side of your cheek. Okay. To seal the nose as you seal the mouth. For infants, we're going to use compression straight up down with 2 fingers. How far do we tilt the head back for an infant to give breaths? It's just to neutral. Infants have a negative head posture, their head's down. You just need to turn it to neutral. Open it up. Okay. If you're actually giving rescue breaths mouth to an infant, it's going to be your mouth to their nose and mouth. You're going to cover both their nose and mouth. Well, with COVID, we're not going to be doing a lot of mouth to mouth to anybody, right? We're going to use some type of protection, whether it be a face shield, a face mask, or hopefully a BBM. Okay. For rescue breaths today, we will do simulated rescue breaths. So if you are a single provider giving CPR, all you have to do is tilt the head, pinch the nose, say breath, 1/1000 breath. Okay. As a single provider for an infant, have the head at neutral, breath, 1/1000 breath is all you have to do. Okay. There are BBMs for team situations, use those in a team situation. As a single provider, you're going to use a BBM, not doing CPR. If you're just doing breath, yes, but not. Okay. With the AEDs, how do I apply the pads for an adult? Right shoulder and left breast area, right? But what's the most important thing to do with the AED? Turn it on. There was a recent study done where they had a group of 3rd graders and a recent college graduates. Gave them the exact same scenario and gave them the AEDs. Which group do you think did better? The 3rd graders did. Why did the 3rd graders do better using an AED than a set of recent college graduates? They followed directions. They did not question the machine or thought they knew more than the machine. They followed the directions. Turn the AED on and follow its directions. Okay? So we'll turn it on, follow its directions. My question is, after the AED shocks, what are we going to do? Immediately begin to resume compressions, right? Turn it on.
Apply pads to patient's bare chest. Plug in pads connector next to flashing light.
Apply pads.
Apply pads, plug in connector.
Connector, flashing light.
Analyzing heart rhythm. Do not touch the patient.
Clear.
Shock advised. Charging. Stay clear of patient.
Clear.
Deliver shock now. Press the orange button now. Shock delivered.
1 and 2 and 3 and 4.
Begin CPR.
Okay. The AEDs most of them have a metronome built into them. It will beep. Every one of these beeps is a compression. Okay. Some actually talk to you. They'll beep and say 10, beep, 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 20, 30. Some actually tell you to take rescue breaths. Okay, depending upon the model you have. Okay. Any questions about the AED? So let's say I open up the AED and I find only infant pads and I have an adult. Can I use the infant pads on the adult? Got a couple of heads shaking no. Who says no, raise your hand. Who says yes, raise your hand. Who's unsure, raise your hand. No, you cannot use infant pads on an adult. They will not deliver enough shock to restart an adult heart. Do not use infant pads on an adult. They are only for infants. If I'm using infant pads on an infant, how am I going to apply them? Front and back, right? If you come across youth pads, follow the manufacturer instructions for youth pads. I open up the AED kit, I find adult pads, and I find youth or infant pads. I have a 10-year-old youth. Which ones am I going to use? Adult. And how am I going to apply them? It depends. Okay. Depends upon their size. If you can apply the pads in the normal position and they are not going to touch or be within 2 inches of each other, you're fine. If you go to apply them and you know they're going to be within 2 inches of each other or they're going to touch, you would then place them front and back. Okay. Open up the AED kit. All I have is adult pads. I have a 7-month-old infant. What am I going to do? Use adult pads. How am I going to apply them? Front and back. Think of this. Your adult pads are your universal sets of pads. You can use them on anybody. It's just how you apply them. Okay. Alright, I'm going to show you the multiple provider video again.
Fifteen, 16, 17, 18.
Now let's watch as the team performs CPR already in progress.
25, 26, 27, 28, 29, 30. 1 and 2.
Switch positions about every 2 minutes, which should take no more than 10 seconds. The compressor calls for a position change by saying switch in place of the number 1 in the compression cycle, as Greg will show you.
25, 26, 27, 28, 29, 30. Switch and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
One, 2, 3, 4, 5, 6.
As with any patient in cardiac arrest, if a patient shows obvious sign of life, stop CPR and monitor the airway, breathing, and pulse.
1, 2, 3, 4, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 12.
Stop CPR. I see movement.
I'll check for pulse and respiration. 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000.
Okay, any questions about multiple provider CPR? You will each have a chance to be the team lead in a scenario for multiple provider CPR. As the team lead, if there are signs of life, you are to stop CPR and then you will check as the team lead for a pulse and breathing. Okay? How can you tell if someone's choking? Universal sign for choking, that's the best one, right? So if someone's doing this and they're coughing, are they choking? No. What are we going to do for someone doing this and coughing? What?
Encourage them to cough.
Yeah, encourage them to cough it up. So if someone's coughing, I'm Chris, I'm an EMT, can I help you? You know what, you're doing a great job, keep coughing it up. Keep coughing, doing a great job, cough harder, cough harder. That's all you need to do, okay? Now, don't say, Chris, you're an EMT, use your name and your certification level, okay? You don't get in trouble. So once they stop coughing, what are we going to do? Have it come out. What are you going to do? Wait,
You have to ask for consent.
you did that when you asked them to
Okay.
help. You got that.
Then you come behind them.
Then you're gonna do the abdominal thrust, right? So with the abdominal thrust, where do we place our hands? Right above the navel, right? What's the easiest way to find the belly button or navel on anyone? What do you think it is? Go ahead and point to your belly button. I'm gonna give you 5 abdominal thrusts. See how easy he did it. That's all you need to do. Tell them what you're going to do. Have them point to it, okay? Because you're telling them what you're doing. You're informing them of what you're going to do to them. Because it actually isn't really that comfortable when you do this to them, okay? If they can't or won't point to their belly button, the top of the hip bones straight in front will take you to the belly button, or the navel. When you do this, you want to make sure you have a leg with a good stance and your feet is between theirs. Okay, why do I want my leg there?
In case they lose consciousness.
In case they become unresponsive, where are they going? Down and forward, right? If your leg's not there, where are you going? Down and forward with them, becoming patient number 2. Don't become patient number 2. Reach in front of them, right above their navel, and in and out 5 times with J motion. Okay? Be cautious because if it comes out, the object can travel up to 20 feet when it comes out. Okay? Let's say we've done the 5 abdominal thrust, it doesn't come out. What are we going to do now? Back loads, yep. So you'll stand perpendicular to them. Your shoulders even or slightly in front of theirs. Reach underneath their arm, grab their opposite shoulder, bend them forward so they are parallel to the floor. Then 5 back lows between the shoulder blades. Okay. Keep repeating this until it comes out or they become unresponsive. Okay. As soon as they stop coughing before we do the abdominal thrust, we need to call for additional help or call 911. The reason being is if they become unresponsive, help has already been called for. We're not waiting for them to become unresponsive. Okay? They're unresponsive, we've laid them down. What are we going to do now? Immediately begin chest compressions, right? 1 and 30. What are we going to do now? We're going to open the airway, head, tilt, chin. We're going to look to see if we can see the object. If we can see the object and safely remove it, we will do so. By safely remove it, a simple finger sweep through the mouth. We're not going on a fishing expedition to try to get this thing out. Okay. The general rule of thumb is in the teeth area, pretty easily removable. If it's behind the teeth, not so much, right? If you don't see it or can't get it out, try to give 1 rescue breath. If the rescue breath goes in, wonderful. Give a second one. Resume chest compressions. If it doesn't go in, reposition the head. Try a second breath. If the second breath goes in, wonderful. Resume chest compressions. If it doesn't go in, resume chest compressions. Okay? Or use any other technique that your institution requires for advanced or basic airways. Okay? For youth, just get down to their level. They're small adults for this. Okay? Infants. Infants never choke because infants never put things in their mouth, right? Okay. So infant starts choking. What are we going to do? We're going to pick them up, let them straddle our arm, support their head. Put them at a downward angle so the shoulders are below the hips. Shoulders are below the hips. You want gravity working for you. Use it. It's free. Okay. 1, 2, 3, 4, 5. Support the head, flip them over the other arm. Still downward angle. 1, 2, 3, 4, 5. Keep repeating until they become unresponsive or the object comes out. Now, if the object comes out, wonderful. If they become unresponsive, we're going to do the exact same thing we would do with the adult. We're going to immediately start CPR, and we'll check the mouth and give rescue breaths as appropriate. Okay? Any questions about choking? Let's say, so for an adult, for CPR, single provider is 30-2 compression to breath ratio. What is it for a youth, single provider? 30-2. What is it for an infant, single provider? 30-2 as a single provider. Multiple provider for an adult. breath to compression ratio? 30 to 2. What is it for a youth? Youth, multiple provider. 15 to 2. What is it for an infant? 15 to 2. What else changes with multiple provider for an infant? The way we do compressions, right? So with multiple provider for an infant, we'll reach around their body with our hands, use our thumbs to do the compressions. Okay? Any questions? All right. We are going to do the practical part. I need a volunteer on each team to do the infants. You're going to do the infant on team 1. Who wants to do infant on team 2? Okay, she raised her hand first. Infant on team 3, who would like to do it? Okay. Who wants to go first on team 1 for the adult? Okay, team 2, you want to go? Team 3, who wants to go first? All right. Here's your scenario for the first adult code. You're working in a hospital. You go in to check on Mrs. Gray. Mrs. Gray is a lovely 87-year-old lady. She just had a double knee replacement. Guess who shows up every morning to visit her? Mr. Gray. So you go and check on Mrs. Gray. Mr. Gray comes in, says good morning to you. You start talking to him, and he collapses. Go. Mr. Gray just collapsed.
Call code. Mr. Gray, are you?
Yeah, put your gloves on and do it. Yeah, this is the practical part.
Okay.
This is go time.
Call a code.
Yep, and team leaders for team, if people are going first, the other people in your row are your teammates. They're walking by in the hallway or whatever, and you can tell them to do stuff.
Can you get the AED? Yeah, I got the AED.
You're working on your individual mannequins.
Oh.
Teammates, I will tell you when you come back, because in the hospital, even though it is a hospital, the code card is never outside the room you need it in. It's always at the other end of the hallway. No, you're not back yet. She's going first. She's leading it. Yeah. She's going to tell you what to do. All right. Go.
No pulse, no,
No pulse, no breathing. All right. You can tell your teammates to do anything for you?
You're getting the AED.
All right. Remember, you can do compressions while.
Alright, you call for help, you're getting the AED, and you get the bag and start respiration. You don't have a bag.
All right, they're not back yet. They're not back yet. I'll tell them when they're back.
Can we share? Okay. Single.
What?
Are you back yet?
No, they're not back yet.
Oh.
As a single provider, just say breath, breath. You wouldn't have able time to use the bag. You would not have time to use the bag as a single provider.
Okay. Breath.
All right, teammates, you're back. You can help out.
Attach the AED.
You're staying on your
Do
man.
respiration.
I'm so confused. Okay, I see where this is. Okay, I see.
For socially distanced. Makes sense now?
So we're pretending.
Yeah. Just simulate putting them on. I thought everyone had an AED.
Apply pads to patient's bare chest. Plug in pad connector next to flashing light. Apply pads, plug in connector.
She's doing breath. Get the AED on. Get the AED on.
Analyzing heart rate.
She's doing breath. She's doing compression.
Do not touch the patient. Everyone stand. Shock advised.
Just just go.
Charging. Apply pads to patients. Stay clear of patient pad connector next to flashing lights. Shock now. Register. Shock delivered.
Turn it off.
Apply pad. Begin CPR.
Shock advised. Prepare to shock.
That's the rhythm, I guess.
Shock. Push the flashing yellow button for shock. Shock delivered. Call for a switch on your next cycle. Call for a switch on your next cycle. Call for a switch on your next cycle. You'll take over compressions. You'll take over compressions. You'll take over compressions.
80 seconds of CPR remaining.
Now, it's a little bit easier when you're working on the same person. But like I said, the closed loop communication is that much more important. Why do you take off the pads?
Okay.
It's one patient. You don't need to run. He has it on. It's all one patient, remember? She's getting your breath for you. It's one patient. Keep going. Mr. Gray's legs are moving.
Stop CPR.
He's breathing and has a pulse. Yay! All right, everyone turn off the AEDs, take the AEDs off. A little confusing on the first time working on 3 different mannequins as one patient. Like I said, that's why the closed loop communication is that much more important doing it this way, okay? Any questions? Team 1, how do you guys think you did? Couple little hiccups, yeah. Team 2, how do you think you guys did?
I think it was okay. It was hard to hear which AED.
Well, yeah, that's also, yeah. Team 3?
A little weird how mine suffers.
Yeah. Okay. All right. You're shopping at your favorite grocery store. You're in line to check out. There's a mom in front of you, has a baby in a cart carrier in the shopping cart, right? You know, little seating area. And they're feeding them cut up grapes. See where this is going, don't you? You're in line. The 8-month-old is in the car carrier in front of you, starts choking on said grape. You will need to do 2 cycles of choking. So 5 back loads, 5 chest thrusts, 5 back loads, 5 chest thrusts. Miraculously, the object comes out after the last chest thrust. Yay, baby saved, right? Yeah, not quite, not yet. Not today. You check, they are not breathing, and they don't have a pulse. You need to do 3 cycles of single provider CPR, okay? The 2 cycles of choking, followed by 3 cycles of single provider infant CPR, okay? Any questions? Go! My baby's choking, help me, my baby's choking, help me! I know, I can't get the female voice down as much as I try. Remember, keep the shoulders below the hips of the infant. Shoulders below the hips. You want a downward angle. You want gravity helping you out. Uniform. Yes, unfortunately. Yes.
Okay.
Yeah. Like a football.
Okay.
Remember, 2 cycles of choking, followed by 3 single provider CPR. When you're done your 3 cycles, go ahead and sit back in your chair. All right, the last thing you have to do is cover issuance of Narcan. That takes about an hour and a half to finish up the class, okay? I'm glad one person laughed. Okay. If you encounter a situation where you have to issue Narcan, treat the underlying conditions first. If they're not breathing, do rescue breaths, or if they're in cardiac arrest, treating that, okay? Once you determine that they've overdosed and you got to issue Narcan, 1 milligram per nostril, wait 4 minutes, get a second dose, okay? Follow your institutional protocols for issuance of Narcan. The only advice I can give you is if you issue Narcan, be very cognizant that the person may become violent. If they don't become violent, there's a good possibility they will vomit. Either way, I'm not a big fan of being hit or vomited on, so I try to stay back, okay? Any questions about issuance of Narcan? All right. Any questions at all? All right. You will receive your certificates within 24 to 72 hours. If you paid for same-day service, you will receive it later today. All right. Thank you and enjoy the rest of your weekend. Put the trash can back by the door for your gloves.